There's probably no greater controversy in literary circles than did William Shakespeare write the works of William Shakespeare? If you drop in on the internet and take a look at this controversy, you're going to be surprised, probably, at how virulent this debate is. Name-calling, people saying it's obvious it was written by someone else, and so on and so forth and so forth. I don't know who wrote William Shakespeare. I read a lot of it when I was in school. But there's another question about William Shakespeare that is just as interesting, maybe more so in the connection of this course. Did William Shakespeare have syphilis? Why do we care? Well, when you read Shakespeare, you find out that he, or whoever wrote it, spends an awful lot of time talking about syphilis and other STDs, or as they were known till recently, venereal diseases. Now, it's interesting as scholars look into the works of Shakespeare that the references to sexually transmitted diseases are not constant. In some of the plays, it's pretty common, his discussion of characters with it or issues related to the sufferings of probably syphilis in most cases. Names for venereal diseases as creative and as long a list as you can imagine. In the sonnets, there is some considerable reference to the difficulties that STDs cause for lovers. So the question becomes, if Shakespeare did not have his own deep troubles with sexually transmitted diseases, he was certainly awfully familiar with the problems that STDs were creating back in those times, back in the Elizabethan era, as we may call it. One scholar suggested it's a similar kind of familiarity that anyone in the entertainment community had in the 1980s with AIDS. Didn't have to have it to understand very fully what kind of an impact it was having on your colleagues. Dr. John Ross, who spent a great deal of time investigating the diseases that afflicted famous writers, eminent writers, has suggested that there is some fair evidence that symptoms Shakespeare exhibited, for example, his tremulous handwriting in his will, and maybe even his premature baldness, were the result not of syphilis, but instead of the common treatment for syphilis, which was inhaling mercury vapors. When Craig talked about the disease of syphilis in an earlier unit, he talked about how folks thought that somehow mercury was going to handle syphilis. And the effects of the mercury treatments, probably a lot worse than the syphilis in some cases. Another treatment for syphilis that was pretty common back in the days of William Shakespeare was to take hot baths, steam baths and so on. And these were very effective, by the way. They didn't understand why, but it turns out that the critter that causes syphilis doesn't do very well in bodies with an elevated temperature. So if you could increase the body temperature of a person, probably to somewhat dangerous levels, you could kill the little bugger off. And there is plenty of evidence that Shakespeare and other members of that great community of writers at the time were engaging in these hot bath treatments. So again, the question of whether or not he had the disease is really kind of beside the point. There's no question when you read Elizabethan literature that it had a tremendous effect on the stories that these writers told. Indeed, the presence of venereal disease in the writings of Elizabethan authors is as ubiquitous as wars with France and frustrating women and long, glib soliloquies. So this is a case when we look at the history of disease and how it has affected disease, or how has it affected, in this case, an aspect of life 500 years ago. We can be pretty sure that it was everywhere, and it was very, very potent in terms of how it influenced the way people looked at life. And because of how it influenced the way people looked at life, it influenced very heavily the way they wrote about life and the way they considered the mysteries of life.